Ovulation. Signs of ovulation and how to increase ovulation. Ovulation is a phase in the menstrual cycle when your ovary releases an egg, ovum. Once an egg leaves your ovary, it travels down your fallopian tube, where it waits to be fertilized by the male product. On average, it happens on day 14 of a 28-day menstrual cycle. The process of ovulation begins when your hypothalamus, a part of your brain, releases gonadotropin-releasing hormone, and this causes your pituitary gland, a gland in your brain, to secrete follicle-stimulating hormone and luteinizing hormone. Between days 6 and 14 of your menstrual cycle, follicles in one ovary begin to mature. During days 10 to 14 of the cycle, only one of the developing follicles forms a fully mature egg. Around day 14 in the menstrual cycle, a sudden surge in luteinizing hormone causes the ovary to release this egg. This is ovulation. At this time, when a male bullet is released, fertilization of this egg occurs and then you become pregnant. How many hours does ovulation last? An egg only survives 12 to 24 hours after ovulation. If the male bullet doesn't fertilize the egg, your body reabsorbs it. Unlike your egg, male products can survive for several days in your body. What are the symptoms of ovulation? Every person is different, and not everyone has signs of ovulation. In those that do, the most common symptoms are tender breasts, bloating, minor pelvic or abdominal pain, light bleeding or spotting, changes in the position and firmness of your cervix, heightened sense of smell, taste or sight, mood changes and appetite changes. Heightened sense of smell, taste or sight, mood changes and appetite changes. How many days during ovulation can you get pregnant? Even though your egg only lives for 24 hours, the male products can live in your uterus for between 3 and 5 days. This means you can get pregnant from having intercourses from about 5 days before ovulation to 1 day after ovulation. If pregnancy is your goal, it's better to have the male products already in your body when you ovulate. The highest probability of conception occurs when intercourse takes place 1 to 2 days before ovulation and on the day of ovulation. So if you want to avoid pregnancy, avoid intercourses during these days. Do you still ovulate if you're on birth control? No, if you're taking birth control pills or other hormonal contraception as directed, you shouldn't ovulate. Keep in mind, this is only the case if you're using pills, patches, IUDs or other devices exactly as prescribed. The hormones in birth control work by stopping ovulation and thickening cervical mucus, which makes it harder for male product to swim. Can you ovulate but not get your period? Yes. You can ovulate but not get your period. Technically, if you're ovulating regularly, you should also get your period regularly. However, it's possible to get your period without actually ovulating and to ovulate, but not have a true period. Can medicine help you ovulate? Yes, there are fertility medications to induce ovulation. Talk to your healthcare provider about your symptoms and goals, such as if you wish to become pregnant. They can work with you on the best treatment based on your condition. There are lots of ways to improve your chances of ovulation. For example, you can maintain a healthy weight by eating regular, well-balanced meals, exercise regularly but avoid excessive exercise, and manage your stress levels with relaxation or mindfulness techniques.